Donations to the MUHC Foundation are instrumental in helping innovative projects and studies at the MUHC and the Research Institute of the MUHC. The Mike and Valeria Rosenbloom Foundation made a major contribution in support of Dr. Miguel Burnier's research. This $500,000 gift will fund a project aimed at improving eye care for cancer patients. Dr. Burnier is an ophthalmologist and a senior scientist at the Research Institute of the MUHC, and he joins us now. Hello, Dr. Burnier. How are you today?
Hello, Terry. How are you? It's always a great pleasure and honor to talk to you.
The pleasure is always mine. I always love speaking with you. So let's begin with, how can cancer treatments impact eye health? Because I don't think we often make that connection between a diagnosis of cancer and what it can do to the eyes.
It is a great question. As you know, and most of the people know, cancer is a major public health problem in North America and around the world, by the way. Cancer care has greatly improved, and quality of life of patients has also improved with treatment. But vision is considered one of the most important aspects of quality of life in these cancer patients. And cancer treatment may lead to ocular signs and symptoms, including affecting visual acuity. The early recognition of these side effects is important to minimize ocular manifestations and to improve quality of life throughout the treatment. We have seen oncology patients, particularly with dry eyes and inflammation, and they need to be seen and they need to be taken care of.
How many cancer patients tend to develop eye issues during treatments? Is it a large number?
It's a very large number, and in the literature varies between 30 up to 60% of patients receiving chemotherapy, radiation therapy, or immunotherapy. And of course, the majority is just mild ocular symptoms, particularly dryness, but we have to see them to rule out major ocular symptoms.
So tell us about this specialized eye care program, Dr. Burnier.
Oh, we are very, very excited. The program studies ocular findings in patients undergoing cancer treatment. We perform a complete ophthalmologic examination in those patients, and patients particularly receiving cancer treatments like radiation, chemotherapy, or combinations of both. And we try to diagnose any mild, moderate, or severe ocular event. As cancer patients already have many appointments to attend, we thought it would be ideal for them to be seen at the CIM, our Center for Innovative Medicine, on the same day. And I think that's crucial. On the same day as either they have appointments in oncology for treatment or for consultation. Then being able to see our patients at the CIM allow us to see them in a timely manner and to ensure a safe distance environment for them rather than to have to sit in a crowded clinic. Our ophthalmological unit at the CIM is very, very complete ophthalmological room with machines that are state-of-the-art, like the Claros wide field camera, and all of them have the great advantage, and this is what the patients like the most, of not touching the patient's eyes. This was and continues to be extremely important due to the COVID-19 pandemic.
Yeah, that makes sense. And I love that you mentioned that. We're speaking with Dr. Miguel Burnier, senior scientist at the Research Institute of the MUHC. We're talking about improving eye care for cancer patients. Dr. Burnier, I want to ask you this. So if someone is being treated for cancer at the MUHC, how do they know to get in touch with the CIM and you and your colleagues? Do they speak to their oncologist about it and say, listen, I was hearing about, that my eyes could become a problem during treatments. I want to make sure that it's not an issue. How does that connection get made?
The connection already made because of the program where the oncologists know and they refer the patients to us. And we have a specific part of our team taking care of the oncology program exclusively, and they make the appointments, and the appointment is coordinated with the appointments at the oncology clinic, and they all go to the CIM, and is in a timely manner that they never have to wait that much, never, and is not, and it's a very individual appointment at the CIM, which is great. And when we described that at our Association for Research in Vision Ophthalmology, ARVO meeting 2 years ago, we were awarded with the hot topic of our eye research team because of this particular way we're seeing the cancer patients, and made us very proud.
And what have you been hearing from the patients that you're seeing? They must appreciate what you're doing and the help that you're providing. Tell us about some of the responses from patients.
Yeah, the first 200 patients we saw actually have a little questionnaire, and we asked them specific questions about how they feel. I think One important thing is the fact that the appointment coincides with the appointment in other areas of the hospital. Number two, no waiting period. They just come in, be seen in a very rapid way. But the most important answer was, oh, it's wonderful. Nobody touched my eyes. The machines don't touch my eyes. And most of them don't have to be dilated because the machines are now so modern that can see the retina in the interior of the eye without to have to dilate the pupil.
You talk about this, these incredible pieces of equipment that don't touch the eyes, that are able to see, so far into the eye and all these different problems that can cure. You've been working with eyes for so long. What's it like for you to have seen how far medicine and technology has come in improving and treating eye care?
It is amazing. The number of machines we have today, and the examples are many, OCTs and different types of retinal visualizations, different types of corneal topography, different types of even the way we now check for glasses and all this. It's a completely different story. For the last 20 years, the machinery and the equipment that we have has been really transformed the way we see the eyes. And again, it's a patient-centric research protocol, and we are there just to help the patients and do for them the way we should do with minimal discomfort and get the right diagnosis.
I love the idea of patient-centric treatment. It's as you said, it's the way it should be. I was wondering how long you've been practicing medicine. How long have you been studying eyes and working with eyes? Because I said it's been such a long time, but I don't know actually.
That's a great question. I came from the National Eye Institute in Bethesda, Maryland, to McGill University a little while ago, 1993, almost 30 years ago, as a chair of the department. And I was the chair of the department for 15 years, and I continue to practice the same way. And one thing I'm going to say, because of my contact with the students, and I'm very grateful to them, all sorts of students and all levels, I am able to continue to have the same ideals of when I graduated from medical school. Exactly the same ideals, which patients come first, patients come second, patients come third, and patients are the center of our healthcare system, not as the doctors.
Wow.
Everything is for the patients.
That's so beautiful. What keeps you so excited and passionate about what you do? Where does that come from?
I'm going to say to you two things. One is one is medicine. Medicine is my life, and medicine gave me and make whoever I am and whoever qualities I have, I owe to medicine. And second, imagine this, is one of the rare occasions that even my wife thinks that I'm very cool and very good in medicine inside the hospital. I'm a disaster in the kitchen. I'm a disaster driving the car. I'm a disaster in other areas. But in medicine and inside the hospital, even my wife thinks that I'm very cool. And there's another thing. Sophia, my granddaughter, who is 9, certainly thinks that I'm the best doctor in the world.
Oh, I believe it. We're speaking with...
That makes medicine. So, listen, I was born to be a doctor, and medicine is everything to me.
It's beautiful. We're speaking with the best doctor in the world, according to 9-year-old Sophia, Dr. Miguel Burnier, senior scientist at the Research Institute of the McGill University Health Center. We're talking about eye care for cancer patients. So this program that you've just been telling us about was supported by the Mike and Valeria Rosenbloom Foundation, $500,000 donation to the MUHC Foundation. How does philanthropy, Dr. Burnier, help support programs like the one you've just been telling us about?
Thank you for the question. I give him the opportunity to tell you how grateful we are from the support of Mike and Valeria Rosenbloom Foundation to this work. This is extremely important to me and to our team. And my team is composed of researchers, clinical fellows, medical students, graduate students. Our patients are benefiting a great deal from this study in receiving personalized care as needed and the end results that we hope we will achieve. Our students are also benefiting from the experience, the training, and the specialized equipment that we have, and of course the opportunity to interact with the teams at the MUHC, like oncology and our patients. We really hope to help to educate the new generation of clinician scientists who are ophthalmologists in academic centers, helping the special needs of patients in oncology. And the patient-centric nature of our research is the most important characteristic. I cannot emphasize enough the importance of the support we're receiving from the Mike and Valeria Rosenblum Foundation. We could not do it without them. And I'm going to tell something too that's written at the SIM and the mission statement of our unit. We don't do research as an intellectual exercise. We do research because there is a patient at the end of the day. And I'm very proud that all my team and all my students of all levels, they really believe in those words.
Well, I think it's very, very clear that you believe in them very deeply. Dr. Miguel Burnier, thank you so much for joining us on the show. It's always a pleasure to speak with you.
It was a pleasure and an honor, and you're wonderful, and thank you very much for what you do for us. Very important work, Tarah. Thank you.
Thank you so much, Dr. Burnier.